we end up with healthcare that's expensive and inefficient. So, I became interested in telemedicine to address these inefficiencies. I started thinking about it around 2000. I founded SwiftMD. I really started working on it in 06, 07. The company started in November of 08. That was the era of consumer-directed healthcare. We've now moved to an era of government-controlled healthcare, Obamacare, and that has unfortunately arrested the development of a new approach to healthcare that could really, really be transformational. And it's not transformational to give people Medicaid, or Medicaid equivalent, which is what Obamacare does, because 40% of physicians don't even accept Medicaid. So you're going to increase demand without increasing supply. Well, you don't have to be a genius to figure out what's going to happen to quality and cost.
So let me ask you this. So you had been what was the original thought when you started SwiftMD? The thought was just to harness. Was it more around telemedicine, or was it more around harnessing technology and making that kind of scale?
It was around both. Ultimately, what I want to do is demonstrate a transformational model where, SwiftMD is healthcare by physicians, primarily using telephone. And later on, I can tell you what we've learned about what consumers really want. What I really want to do was to demonstrate a transformational model, ultimately in which patient consumers, using their health savings account dollars or their pre-deduction dollars would basically have an option that was less expensive in financially and less expensive in time than going to an urgent care center, ER, with a regular doctor for the common problems that represent most people's healthcare needs. If you're a 40-year-old man or a woman, if you're a 40-year-old man, just the average guy in the country, you don't have cancer or diabetes. You have two healthcare problems a year. You have an infectious process, and then you have either a work or sports-related traumatic injury. If you're a woman, you can add in a third visit for a reproductive health care need. Well, for those people to have to, in New York, place like New York, have to go out and have either purchase themselves or have an employer purchase for them a $14,000 policy is absurd. So, SwiftMD is an attempt to give those people their health care needs in real time, leading to significant savings in healthcare, and I want to demonstrate as well that there will be not only would the quality of healthcare be equivalent, but actually be better if people were being taken care of out of doctors' offices and out of ERs for the common problems that represent the bulk of the reason why people seek healthcare.
Sure. And so you decided to launch SwiftMD, and how did you do that? Did you fund this entirely yourself? Did you start out very small? Did you look around for people that you knew that, angels that might kind of, kick in some money?
With SwiftMD, I went to my physician network through Pegasus, and we raised the money through that physician network. I was obviously one of the major investors. There was no outside angel. There's no venture capital. Just physicians who saw this to whom this idea appealed, because they knew from their own experience in emergency departments that if they were treating these people the way in which they treated their friends and family, they could take care of them on the phone.
And so tell me how SwiftMD actually operates. I mean, going through the website, I basically, if I am subscribed to the service, I make a request, and then a physician, calls me back. How does that actually operate? How does that get channeled or funneled? How do you manage that time-wise with your physicians? And since you're offering 24-hour service, how do you group all of that together?
The physician experience, the physicians are working 12-hour shifts. Unlike our competitors, our physicians are working dedicated shifts, so our response times are good, and they're being paid by the contact. They make $35 per contact. On the customer side, we have over 9,000 customers in the greater New York City area. Majority of them coming from one union that self-insures, and these people can either access us through the call center or through going online. And then the physician gets a text on their cell phone, the patient's number. The physician can either respond to that patient just with the phone number, or they can go, if they're by a computer, they can turn on go into our application, go into the patient portal, and pull up the patient's healthcare record. And most of the problems that we deal with are the type of things you'd see in an urgent care center. Low back pain, urinary tract infection, poison ivy, insect bite. Our response time to a call is about, last time it's 18 minutes. And
what's your average time that the physician spends on a call?
Less than 7 minutes. It's 5 to 7 minutes. And for the physician, we have a computer-assisted diagnosis. So we basically push our doctors to ask the right questions that would rule out more serious conditions that would warrant the patient going to an ER.
And what kind of potential liability challenges have you faced doing this? Because obviously this is utilizing a technology, but there is a, how do you, are you practicing also attempting to practice defensive medicine or CYA medicine?
Well, one thing that's fascinating about it is initially a lot of physicians say, well, gee, I just don't feel comfortable doing this. I don't know if I'm going to feel comfortable doing this, because there's no, getting back to something we were discussing earlier, there's no ability with SwiftMD to order a lab test or order an X-ray. Now we could, as the company grew and grew and grew, we would add that type of functionality. But lo and behold, physicians find that suddenly, if they're in a virtual environment, they're able to manage sore throats. I had a case of zoster the other day. We're able to manage these things without a lab. And even without an X-ray. After all, if you observe the auto ankle rules, most ankle sprains don't need to be X-rayed. So if you have someone online who tells you, gee, I twisted my ankle playing squash, but I can bear weight on it. It hurts, but I can bear weight on it, and I can walk. That patient does not need an X-ray. So the temptation actually to order unnecessary tests is gone with this. We've restored a certain honesty and transparency to the healthcare system with this type of approach to healthcare. But we carry the same malpractice insurance that people carry in the ER. We have 1 in 3 million. We have not had any lawsuits. We've been in business since November of 2008. We've had no problems.
How many patients does a physician call during an average, shift?
Let's talk about the seeing piece of it. We have bidirectional video capability. We find that patients don't want it. People want the convenience of using their phone. Perhaps some people want the privacy. We've had some women tell us, well, I haven't done my hair today.
Sure.
People simply aren't asking for it. I think that as people get more and more comfortable with telemedicine, and as the cell phones incorporate more and more 3G technology, we will move in that direction. Although there is an issue of HIPAA compliance with the type of with Skype, for example. Skype
Sure.
is not compliant. Theoretically, your neighbor could be.
Do you have any numbers wrapped around how much money you potentially have saved in healthcare costs by doing this as opposed to ER visits or even, general practice visits or office visits? It's difficult to calculate, and to be honest, because if you're an employer and you give people SwiftMD, are people going to utilize that service because it's convenient and they wouldn't have gone to a doctor because it's inconvenient? In other words, a person who called Sure, they just have access to it, so they've used it where it's a lower barrier.
Exactly. On the other hand, if we've had patients who we have steered away, if you're a self-insured entity, and SwiftMD, I'll give you an example. I had a patient who had seen his family doctor that day to rule out appendicitis, and the family doctor told him it wasn't appendicitis. And then he called me 5 hours later, and I told him he did have appendicitis because of, it's a fascinating case because the guy that had a low-grade temperature described pain migrating from his belly button down to his right lower quadrant. I had asked him to jump up and down a couple of times. He said it hurt more in his right lower quadrant. I told him he had appendicitis. I need to go to the doctor meeting. And the guy was working a shift at work. If he, so how do you quantify the benefit to that? If the guy had delayed, his family doctor wanted to see him 2 days later. If the guy delayed 2 days and ended up with an abscess, well, I might have, and the entity, he works for a self-insured entity. That might have cost the self-insured entity $60,000, $80,000. So, on the other hand, how would he actually behave? How would he have actually acted? Would there have been a delay that long? Would there have been an abscess? So, science, it's hard to quantify.
Sure. Let's change subjects for just a little bit. So you're managing technology. Have you been a technologist, or you've developed, you've got an online portal and you've got other things that are kind of managing this? How did you go about developing those?
We hired a technology team to build the application for us. Components of the application we license from vendors, and then there are aspects of it that are proprietary. One piece is proprietary, and unfortunately it's underutilized because it's potentially so powerful in terms of cost savings. For the 30 most common problems, urgent care center problems, patients actually have the ability to go into their patient portal and self-diagnose and know whether or not they need to get an X-ray, or what antibiotic is the right cost-effective antibiotic for their sore throat or urinary tract infection. That information which we develop, which is proprietary, although
now that's underutilized because patients don't trust themselves to make that diagnosis.
It's hard to say, because our survey data indicate that patients what they really want is to talk to a provider who can write a prescription if it's indicated. So, and our costs are actually low, and someone else is paying. So, if most of the time, so it's if you're a wealthy, if you're a union member who uses SwiftMD, well, the union's paying. So why self-diagnose when you can just call the 877 number and get a doctor? If you're a wealthy individual who uses, because we have quite a few wealthy individuals, not quite a few, let's say we have approximately 35 to 50 high net worth individuals who use SwiftMD. They just want to, they want to talk to a doctor. So it's interesting. If we really want to change healthcare, we have to come up with incentives that drive people to self-diagnose, because if we're really going to transform healthcare and save money, we need people self-diagnosing for common problems.
So tell me, what challenges has SwiftMD faced and overcome?
When we launched, we quickly got over 9,000 customers. At that time, it was part of our business plan that we would go for a second round of funding, as is common with businesses. And as a result of the implosion of the stock market and the advent of government-controlled healthcare, there's no money in healthcare. We're in venture healthcare right now. The venture capitalists are deterred by the fact that the market has become really uncertain. People don't know what the government is going to do for regulations, specifications, and pricing. So without that certainty, it's difficult to sell this. The insurance companies have become close to zombie industries in that they, as much as the government wants to beat up on them for their revenue, the issue for them is profits. If the Blues, I think, as I recall, last year made 2.2%, well, that's dead. That's a moribund industry. So, investing money is waiting to see what the government is going to do, and that's basically SwiftMD is at this point is going sideways. We have enough revenue to stay in business, but we don't have enough money to aggressively develop a sales program, and those sales will be difficult to make in this market. I mean, the sale in this market is to large self-insured entities or third-party payers, and for them to deliver the healthcare more efficiently, less expensively. But that's a difficult sale in a market where there's so much uncertainty about regulation.
Is this